Brooklyn Independent Television.
Coming up on Healthbeat Brooklyn.
Night driving has become an issue.
Our host gets her eyesight checked out on camera.
KOZF-PVHA.
She knows certain problems can develop before any symptoms show, and yet how easy it is to get the right kind of exam.
What I'd like you to do now is look straight ahead.
How much do you smoke?
Maybe 1 or 2 cigarettes a day.
Okay.
Just how big a deal is it if your habit is barely a habit?
Even 1 cigarette a day is much too much.
What does a person like me do?
This doctor has some very specific suggestions. And when a patient is in so much pain that regular physical therapy is out of the question, the solution may be a big box full of water.
It takes a lot of the weight off of the spine so that he can move around a little bit easier.
All this and more on Healthbeat Brooklyn.
Welcome to Healthbeat Brooklyn on Brooklyn Independent Television. I'm Dr. Monica Sweeney. If you absolutely had to choose, which of your 5 senses would you least like to lose? Based on a survey by Lighthouse International, the vast majority of Americans, more than 80%, would keep their sight above all else. So why don't more of us get regular eye exams? An eye expert will be here to discuss that in a moment. But first, here's what happened when that same expert, an ophthalmologist at SUNY Downstate, took a long, deep look into my eyes.
Good morning, Dr. Sweeney.
Good morning.
How are you doing today?
Well, and I'm glad we finally got together.
Nice to see you
It's
today.
nice to see you.
How is your medical situation now? Are you stable from a medical standpoint?
I am the healthiest, mature adult you'll ever meet.
That's great.
I take nothing.
That's
Zero.
excellent.
Have nothing. No high blood pressure, no diabetes, no anything.
That's great to hear, and we want you to stay healthy for a long period of time.
Thank you.
How are your eyes doing today?
Oh, that's a different story.
Why don't you start at the beginning?
The beginning is that, especially when I'm tired or hungry, I need to pull out my reading glasses with fine print, but that's the only time. Then night driving has become an issue. I can't go to unfamiliar places and drive, but if I'm going locally, well lighted, it's fine. But my night vision is definitely an issue.
Okay. Why don't we start by taking your vision today? And start by reading the chart on the wall.
KOZF-PVHA.
And how about this chart?
No.
Let's have you switch that around. Why don't you try that?
KOZF-PVHA, RZCNADTP.
Excellent. Okay, great. I'd like you to focus by looking straight ahead with both eyes wide open. Pupils are normal. Dr. Sweeney, I'm going to put a drop in now. It's a local anesthetic. It's going to be used to measure the pressure. It's one of the ways we measure the pressure to screen for glaucoma. And you can keep your eyes closed just for a couple of seconds. Are you okay?
I'm fine.
Okay. We'll start by having you come forward to get your eyes examined.
For the information you're about to give me, it's a small price to pay.
Or you can put your chin right here. I'll raise that up for you a little bit. Are you comfortable?
Yes.
Okay. What I'd like you to do now is look straight ahead. We always take a look at the outside part of the eyes first. We look at the eyelids to make sure there are no skin cancers, because skin cancer can present on the eyelids and the ocular surface. Your lids look excellent. And we use a fluorescein light to see how the ocular surfaces blink a little bit. Open up. Your ocular surface looks good. We'll take your intraocular pressure now. Look straight ahead. Pressure is 19, which is normal range. And it's 20 in the left eye, so it's 19 in the right and 20 in the left. Look straight. Optic nerve is sharp. The optic nerve cup is a little bit on the large side. Have you ever had an automated visual field test? We've had to press a button when you see the light?
No, they told me I should get one.
You need one.
Okay.
Your macula looks excellent. So one of the things we can do today that I think would be very useful is an optic nerve image, because it's the latest imaging technique in the United States, and it's one of the ways we can help see what the optic nerve function is. It's a little bit thin in one quadrant. Okay?
That's what the yellow is.
What the yellow is. You can see, even with the naked eye, that the optic nerve cup is a little bit larger in the left compared to the right. And so it is something that we have to follow closely to make sure this is not representing early glaucoma. It's really important to do a comprehensive eye exam so that if you have something, we can treat it early.
If you see something, you can do something.
Absolutely.
As you've just seen, there's a lot more to a thorough eye exam than meets the eye. Despite what a lot of people think, it's not just meant to provide you with a prescription for glasses. An eye exam can indicate cataracts, glaucoma, even diabetes. And once again, here to discuss all this and to tell me how I did on my exam is Dr. Doug Lazaro, Chair of Ophthalmology at SUNY Downstate Medical Center. Thank you very much for being here.
Thanks.
So what I want to know is, I'm very happy that I finally got to get my comprehensive eye exam. I want to know how I did.
So your eye exam overall was pretty good. However, there was one abnormality that we picked up, which is potentially a very early stage of glaucoma. So we're going to do some additional testing, and I do want to point out that it's essential to come back for those tests, including a visual field, and then we'll make a proper determination of whether or not you have it or not.
I certainly don't have any symptoms, but I will certainly follow up. And that's what we all have to do when something is found, follow up. I'm just wondering why it is that people don't go and get a routine eye exam more.
Firstly, in our borough, we have a lot of patients that are uninsured, no health insurance. So for many of those patients, they may only use the emergency room for acute problems, and they're not going to seek out the emergency room for an eye exam. So that is one real barrier in the borough of Brooklyn.
And they don't know how to look up the places that give eye exams free of charge, like you all do sometimes.
Exactly. We actually will take care of any patient regardless of the ability to pay, whether or not they have insurance or not. And I think even a bigger factor is that some of our patients go to get eyeglasses filled.
Right.
So they go for their prescription. They're told their vision is okay on the chart. They get a new pair of glasses.
When you say the chart, you mean when you just say E and whatever those letters are? That's what you mean on the chart?
Exactly. So
Okay.
they'll read a vision chart in the store. They'll get a new pair of glasses, and they'll equate that with a new complete eye examination. And the problem with that is a patient can be 20/20, see those tiny letters on the chart, and actually have a series of eye diseases even with 20/20 vision. So the take-home message is to get a complete eye exam even if you've gone just for glasses.
The other point that I want to make early on is what the three most common conditions are in the populations that you see here in Brooklyn. What are the conditions most responsible for people losing the ability to see?
Probably the most common is cataract. Cataract is where the lens of the eye, just like the lens of the camera, becomes cloudy and interferes with vision. And it can be anywhere from mild to severe. The good news about cataract is we're pretty good as ophthalmic surgeons taking out cataracts, doing an operation, and replacing it with an artificial lens.
And once that's done, that's a problem solved.
That's correct. In 99% of cases, surgery is successful and the problem is resolved and the patient sees sometimes much better than they've seen in the last 5, 10, 15 years.
Okay, you mentioned glaucoma.
Glaucoma is called the silent thief of sight, and with good reason. Glaucoma can actually take away the center part of your vision very late in the disease. Very late in the disease. So you can actually be 20/20 with glaucoma and have end-stage glaucoma and not know it. So
end-stage glaucoma, you can have end-stage disease and have 20/20 vision.
Exactly correct. And that's the problem with the disease. If you go for just glasses, you can have lost most of your optic nerve function, which glaucoma affects, and still be 20/20 until very late in the disease. And then at the very end stage, it takes away your central vision and you basically can't see. And the problem is it's irreversible. Whatever you lose in glaucoma, you can't get back.
Now the question is, how often should adults without symptoms get a comprehensive eye exam?
I would say at least annually.
Okay.
I think it's important, even if you don't have symptoms. The average age of diagnosis of glaucoma in the United States is presently 52. So I think you have to get your eyes examined. Again, many of these diseases don't present with symptoms early on. For that matter, macular degeneration, the leading cause of blindness in the United States over the age of 65, in many cases is asymptomatic early on.
What age should people start getting the annual eye exam?
So that's a great question. We actually recommend, and the American Academy of Ophthalmology recommends, children at age 4 start getting a complete examination. If the exam is normal at age 4 and there are no problems with the birth and no prematurity when the baby was born, 2 or 3 years later is probably sufficient. But adults should get examined every year. And again, when we say examinations, we mean a comprehensive eye exam, eye drops, dilated pupils, looking at the retina and the optic nerve closely to make sure we don't miss anything that could be lurking inside the eye.
Now on to diabetes, which is, as a practicing internist, when I was a practicing internist, that's what I saw a lot of in Brooklyn. That's responsible for a lot of visual changes. So talk to us about that.
So diabetes is maybe the second leading cause of blindness in the United States. Here in the borough of Brooklyn, we have many, many patients that have already suffered irreversible blindness. One of the reasons is they present, again, late in the disease. So we have patients that have had diabetes for a number of years, haven't gotten a comprehensive eye exam, and end up with diseases that are not easy to manage in the later stages. The good news about diabetes is if you get examined early on in the diagnosis, right after you get that diagnosis, the eye exam can really help you at that stage determine early treatments and manage the disease. And I think if you get managed regularly with diabetes, in many, many cases, the vast majority, you won't lose vision.
That is a message that I want our audience to really take away, because so many diabetics suffer end-stage losses because they don't get treated early. But it's not only a message for our patients, it's a message for our clinicians as well.
So you bring up an excellent point. Our internists, our primary care docs need to get their doctors for annual screening exams. It's standard of care in 2012. Every diabetic gets at least an annual exam. We as ophthalmologists try to be real doctors too, like the internists, and we tell our patients to try to keep their hemoglobin A1C, that measurement that gives us some idea of their diabetes control, under wraps, and that often can help us manage the eye manifestations. Many patients with advanced kidney disease can end up with diabetic retinopathy. And the way patients generally lose vision from diabetes is when they have the disease manifesting itself in the back of the eye.
Yes. We have a lot of things that I would like to cover, but there's one thing that I want to ask you about because it's been in the news recently, and that is the association between eye disease and daily aspirin. And we don't have time to go into great detail, but I would like you to explain a little bit about wet macular degeneration and the association of daily aspirin, since so many people are on daily aspirin.
So macular degeneration in the United States is the leading cause of blindness over 65. It comes in two major forms: the dry form, which is very common, and the wet form, which is less common but leads to more visual disability. They did an excellent study out of Europe looking at almost 5,000 patients. All the patients were over 65. They separated them out into daily aspirin users and non-daily aspirin users. And it was noted that there was a 4% incidence of the wet form of macular degeneration in the daily aspirin users versus 2% in the non-daily aspirin users. We don't necessarily think that aspirin causes macular degeneration, but it is an association that was recognized and needs definitely more evaluation in future studies.
So we would say to the people who are on daily aspirin, don't, for example, for heart disease or other reasons, don't quit your daily aspirin without going to talk to your ophthalmologist and your internist.
Absolutely. I would say if you need it for your heart, if you need it for the prevention of stroke, if you've had a stroke in the past and you need the aspirin, continue taking the aspirin. And then that leads into a subject that you and I have talked about previously, which is what about recommending certain supplements for our patients?
Well, we can't go into that today, even though our discussions, we were eye to eye on our discussion, or mind to mind. I really hope that with all the other things that we need to discuss about the eye, that you will come back at a future time to have a discussion with us. There's so many things to take into consideration when you're taking care of one of the most precious senses that we have, namely the eye.
I'd be happy to come back and I can discuss it at length.
Thank you very much for being here, and we look forward to that.
Thank you, Dr. Sweeney.
Smoking is bad for your health. We all know this, even those of you who are smokers. But who is a quote-unquote smoker? Certainly not the man or woman who just lights up once a day or so, right? Well, yes. Out in Bay Ridge, we join a doctor and his patient as the subject of cigarettes comes up.
I'm Dr. Lucchese.
Nice to meet you.
So tell me why you're here.
I felt like I had a cough or something coming on, like maybe some sort of a chest cold or something.
Okay.
I just wasn't sure where it was coming from.
Okay, and how long has that been going on for?
For about 3 days now.
Okay.
Yeah.
All right, so I'll have to listen to your lungs and we'll see how that... Just take some deep breaths in and out through your mouth. Good. Let me ask you, do you smoke?
No.
No? Because I could smell it on you.
I had a cigarette last night.
Oh, okay.
Yeah.
So how much do you smoke?
Maybe 1 or 2 cigarettes a day.
Okay. So do you know the problems that there are even with smoking 1 or 2 cigarettes a day?
Yeah.
A lot of times people who smoke in just social situations don't even consider themselves smokers. Even the people who are educated about smoking, there's a lot of people who believe if they don't smoke that much, even just a cigarette or 2 or 3 a day, that does not associate it with detrimental effects. When indeed it really is. Even 1 cigarette a day is much too much. Have you ever tried to quit?
I have. It's really difficult, and unfortunately, I only smoke about 1, maybe 2 cigarettes a day.
Right, so you can't use things like the patch and the gum, because those are much stronger. Even the lowest dose of the patch is geared for somebody that smokes about a half a pack of cigarettes a day. So for you, if you put the patch on, you probably feel very anxious and that would be much too strong for you. Yeah. The symptoms for even light smokers, unfortunately, they may not see them. So it depends upon your lungs and how it reacts to it. You may have a lot of coughing, you may not. So even people who have no symptoms whatsoever from their casual smoking, are still doing harm to their body. It's almost like somebody who's walking around with elevated blood pressure. If it's just mildly elevated, they call hypertension, high blood pressure, the silent killer, because people don't know that they're doing harm to their body. The casual, rare cigarette smoker could be the same way, which is very dangerous.
So what does a person like me do?
Well, what you try to do, what is the cigarette, what is the time of the day that you like? They're the people's favorite cigarettes. There's when they first get up in the morning, after they have a big meal.
That's mine.
The last time they go
cigarette with the coffee.
Okay, so that's sort of a ritual, and that's something that you have to try to change.
Okay. Definitely if you're out drinking, if you're out at a bar, if you're out at a club, if you're out with people that smoke, it's sad to say that at this age you still suffer from that peer pressure. You're out with people that smoke and you feel compelled to want to smoke along with them, as much as you know that it's not good for you, and whether or not you've quit, you say, what's one more cigarette?
People tend to be very vulnerable, and again, this is not just with smoking cigarettes, this has to do with a lot of addictive behavior. You're at your most vulnerable during certain periods of time, and to make it easy to remember, they call it HALT. So H-A-L-T. So you're very vulnerable when you're excessively hungry, when you're angry, when you're lonely, and when you're tired. Okay. So you could anticipate that. One
of the biggest concerns that I've had with trying to quit is withdrawal symptoms, because the last time that I tried to quit, I really went through some serious withdrawal.
Okay, what did you feel?
I had a headache, I couldn't sleep, I felt really anxious and just, jittery all the time for at least about a week.
Okay, and that just shows you how much of an addiction something like nicotine can have on your body. Okay. You might want to avoid caffeinated products, or if you drink a cup of coffee, 2 cups of coffee, you might want to try to drink 1 cup of coffee or no coffee whatsoever. Mm-hmm. Other things you could do to try to relieve that anxiety feeling is, if obviously weather permitting, you can go outside, take a nice long walk, do something normally that might get you a little bit tired, so that at night you don't have the caffeine, you've been walking outside, you've been a little bit more active that day, and then that might help you to fall asleep a little bit better. That actually might last for several days. Okay. The other point is that even if you go several days without smoking, sometimes people will try and it'll take them quite a while to completely stop smoking. They might do it over the course of several months. Even a day without smoking is better than a day that's smoking 1 cigarette. So those are little victories that you should be proud of yourself for. Sometimes we're too hard on ourselves, and we don't appreciate the effort that we're giving. So you might go a week or 2 weeks and then have that cigarette. We'll just jump right back on the bandwagon and stop again.
Thank you very much. I appreciated all of the advice that you gave me, and I'm going to try to take those things into consideration and be mindful of where I go, who I go with, and try to be mindful also of those trigger moments when I'm most likely to want to have a cigarette. So I'm just hoping that it works, and that if it doesn't, that eventually, hopefully, something will come out on the market that could help people like myself.
I think that just you understanding how detrimental even 1 cigarette a day can be is a big step in the right direction. And you accepting that and believing that, it's an important step in quitting smoking. I wish you good luck.
Thank you.
What if you're injured and you need physical therapy, but you're in such discomfort that you have trouble even standing, much less walking or using weight machines? The answer, as Healthbeat Sherry Carabin found out in Park Slope, is water.
Too easy? It's a little easy. No pain, right?
These are the images most of us associate with physical therapy. But not everyone is healthy enough to use these machines, lift weights, or even do traditional stretching exercises.
I've been having a lot of pain in my left elbow.
A few years ago, Bay Ridge resident Marco Alicea was in a serious accident, which left him with multiple injuries.
I have herniated discs down my spine. I have damaged both elbows. I have pain in my wrists, my knees. I have damage in both hips, both ankles.
He's had several surgeries since the accident, but it's still difficult for him to stand for long periods of time or perform other tasks necessary for traditional physical therapy. That's why those at Metro Sports Med recommended aquatic therapy.
It's a bathtub with a treadmill underneath. We generally set it to about 98, 99 degrees at a time. So you want it as close to body temperature as possible without it being too warm, because as soon as they start doing the exercises, it'll really start to heat up. What's that for? It's just to warm up the neck. It's just a heat pack. Basically, what we're trying to do is unweight the joints so that it's not as much pressure for him and it's not as painful for him when he's doing exercises. And that's really what the benefits of the water therapy. It takes a lot of the weight off of the spine so that he can move around a little bit easier. When you're taking that step back, try to keep your back a little bit straighter as you come down.
Metro Sports Med has multiple locations in Brooklyn and one in Manhattan, where they have outpatient care and rehabilitation for various types of problems. A few also offer aquatic therapy using the Aquasizer. Alicea has been coming to this location at 263 7th Avenue for about 3 months.
It's the best warm bath one can possibly get. You get to exercise at almost half your weight. That's what makes it simpler to exercise in my lower extremities.
How long has this machine been around?
Over 10 years or so, but it's only gotten very popular over the last 5 years.
How do you decide who's a good candidate for aquatherapy?
Basically, we look at a patient's history. We see if it's a chronic type of issue or if they can really tolerate what we call land-based treatment, which is treatment outside of the water. So we look at if they have had a recent surgery and just really aren't able to tolerate any weight bearing on a lower extremity, for example, a knee, an ankle, a hip, whatever have you. And then we see would aquatherapy really help them? Would they be able to perform a little bit better after they come out of the Aquasizer in the land-based therapy? We have had children be recommended for the Aquasizer. The youngest that I've seen go in was about 6 years old, and we have the ability to change the height of the waters, so obviously it won't be as full as it would be for a normal adult. Ready to take a break?
The Aquasizer is also used by athletes who are training for competitions.
Generally, athletes can get a very good workout from the resistance that the water provides. It resists them throughout the entire movement.
That was it.
Okay. So I'm going to turn the jets off.
But in Alicea's case, his goals are much more basic. He wants to avoid additional surgery while making as much progress as possible.
Every day that I can get a little less pain is great, and the aquatherapy helps a lot.
For Healthbeat Brooklyn, I'm Sherry Carabin.
That's all for this month. If you want to watch past episodes of the show, go to brickartsmedia.org/BIT and then click on Healthbeat Brooklyn. And you can follow us on Facebook or Twitter on BK Independent TV. Right now, information about the programs and hospitals we've just featured is about to appear on your TV screen. Thanks for watching, and stay healthy.
Watch this and other Brooklyn Independent Television episodes online at brickartsmedia.org/BIT.